Good afternoon, everyone. Good morning, everyone. Welcome to the American Cancer Society Patient Navigation webinar series. We're excited to bring you today session 1 of our series called Increasing Health Equity, Navigating for Equitable Outcomes and Building Resources to Address the Needs of Diverse Populations. This is session 1 of a 3-part series, and we hope that you'll be able to join us for the other 2 coming up that'll be just as terrific. Next slide, please. This webinar is taking place on Zoom. The meeting will be recorded. We will be sending out a recording later on this week. You will be muted, and we will be using the Q&A platform after our presentation. We will be reading questions from the Q&A box to our presenter so that we can have some great discussion. Thank you. We are so thankful to our incredible sponsors and supporters of the Patient Navigation Capacity Building Initiative. Sponsorship for this was led by AstraZeneca and Johnson & Johnson, along with Bristol Myers Squibb. Additional sponsors include GlaxoSmithKline, Genentech, Daiichi Sankyo, Novocure, and Santa Fe. And additional funding supported by an independent educational grant from Pfizer and other supporters. We really appreciate all the support of our sponsors so that we can bring you all this terrific programming. And I'm so excited about today's presentation. I had the distinct pleasure to hear Ife talk at another conference. And as she was talking, I kept writing down just her little gems or messages that really resonated with me. And as she talked, I thought, wow, we really have to, I want to bring her to another audience to really help share her story and help people to think about things in ways that maybe from your own experience, you're not used to thinking this way. So I'm very excited to introduce Ife Leonard. Ife has a profound commitment to intentional spaces that encourage self-awareness and critical reflective practices. Her ability to serve as a catalyst, share stories, and unpack inequities that cause harm assists many in their journey. Ife beautifully uses the transformational movements of educational leadership, clinical social work, and restorative and contemplative practices to supportively guide holistic development and collective humanity. She serves as a professor, executive coach, and consultant nationally and internationally. Ife holds a Bachelor of Science in Human Ecology and 2 Masters, Clinical Social Work and Educational Leadership. And I think I was so excited to bring you Ife. I think I forgot to introduce myself. So I'm Heather Ciccarelli. I am the Director of Patient Navigation Initiatives at the American Cancer Society. And like I said, I'm really so excited. So reading the bio, sounds like you're in for a serious talk, and I can tell you, you're going to really, really enjoy yourself, and you're going to really be thinking about things in a new way. So I'm going to turn things over to Ife, and I would love you to just sit back and really enjoy listening to her talk.
Oh, thank you so much, Heather. Thank you to the American Cancer Society. And that's exactly what we're going to have. We're going to participate in making space, in taking space to share, to be able to have a brave conversation. And so a part of that happened in my story. And in my story, I came into the cancer community when I found my own lump tumor. And I tell you, it was different because they were extremely excited. They were extremely excited. Like, she found her lump, she found her lump. And I think that excitement would have been helpful if it would have been transferred through a patient navigator, through nurses, through physicians, through social workers who were there, through volunteers who were there, so that the excitement went through how do we relate with each other? How do I become a part of the team? Not just an initial, we're on this journey together. And then I really did not feel that we were on the journey together. I came into the space because my work deals with focusing attention on social emotional, um, on relationships, on mental health. Even listening to my own bio, I'm thinking about like, yeah, how do we cultivate brave spaces where I am coming into treatment in the fullness of myself, and that I am engaging with healthcare practitioners who were showing up to work in the fullness of themselves. But inquiries as to not only how am I feeling medically, but what do I need to do to adjust to the personalities, to the prejudice, to the biases, to the assumed stereotypes, or assumed beliefs that come in all of us, because we all have inherited a sense of prejudice and biases that we were all born into. For many people on this, in this webinar, can relate to being a recipient of sexism. I am a recipient of sexism. That is happening to me. I am also a recipient of racism. It is happening to me. And so when you have an additional identity that I did not want to have, living with breast cancer at that time, I did not know that I would also be a recipient of multiple beliefs that were true and untrue. And there were times during my early part of my treatment where I had to say, I am not able to manage soft speaking, over apologizing, and I'll say it like this. So there was one time in my story where someone was like, "Oh, I'm so sorry. I'm so sorry. I don't know what's happening." This was the nurse speaking to me. I had just finished teaching a class at the university, and took myself. I wasn't sure what was happening. Very, very new in chemotherapy, and I was like, "I don't know what's happening." And the nurse was speaking in a tone of like pity, is what I heard, over apologizing as I shared. And I said, I'm not able to manage this. What do you need to say? Just say it plain, because there are so many messages that language communicates. There are unspoken messages and expectations that are communicated when people are speaking in a tone, in a voice, in volume, in mannerisms, facial expressions that communicate so much more than just the words, I'm so sorry. So when I invited her to be able to say what's happening in just plain language, and then she said, "Oh, Ife, we have to admit you to the hospital." And I said, that's so helpful. It's so helpful, because the poor little thing, or you may not understand what's happening. No, no one deserves that. So the disparity is that people can be in a space where you in your roles, even all of us in our individual career roles, as a neighbor, or as a family member, or supporting someone else, check in with the person. How are they feeling? What needs do they have, in an authentic way? People can discern authenticity of empathy and compassion. I am so grateful to be in spaces I was grateful to be in spaces during my treatment where I was able to say, how can I be a part of the team where we can just have conversations and we're managing the relationship. We're managing the relationship as I am learning to manage various parts of the journey of living with cancer. I will share that managing authority, shared decision making, how to navigate. See, I just learned after 4 years the word patient navigator last year in 2023. Never heard it 2018, 2019, during the pandemic, never heard it. But what does it mean to be able to have authentic curiosity with a patient where you can assess where somebody may need help? And when somebody needs help, it doesn't mean only based on race or religion. It means that, how do I assess someone's experience with healthcare? The last time I was in healthcare was when I delivered my son. That was over 20 years ago. So if it's not my world, it doesn't mean that I am stupid. It really means that I am just not knowing, right? Ignorant doesn't have to be a curse word. It just means that I don't know the treatment plan. And I am learning that I am a part of the team. And my story means that other people are inviting me to be a part of the team. So I learned very quickly how to interrupt and how to invite them to relate and share my noticings, like the voice that sounded like pity, whether that was somebody's intent. It's what comes across, because we all inherited ways that we may think that somebody may need for them to be spoken to, and I don't need that. I did have one oncologist who came when I had to admit myself back to the hospital at one point, where he walked into the room and he said, do you know why you're here? And I said, would you say that to your mother? Because when he walked into the room, he saw someone with no eyebrows, no eyelashes, bald, and in a hospital gown. And he was like, excuse me. And the nurse said, let's leave. She literally said that to the doctor. I was grateful for her, because I was not going to manage a question that was insulting. So then when he came back, he said, I apologize, professor. And I said, oh, I'm not here to be a professor. So don't respect me because of the written word of professor, or, people have all of these written words. Senator, governor, I don't know, doctor, bishop, rabbi, imam, reverend, whatever title of the worship that people give greater credibility. But in this body that you came into the room to treat, there's a soul in this body. There are feelings. There's a way to be able to gain social awareness, to understand that there are expectations from patients of civility, kindness, compassionate accountability. Compassionate accountability is a warm-hearted tenderness that someone holds, that they wish to alleviate suffering. They wish to take action to alleviate suffering. I invited that. And it was snarky to be able to respond in that way. That was not kind to say, would you say that to your mother? But I knew that he wouldn't. And I knew that when he saw only brown skin, right? There weren't other identities of femininity or class or occupation or home ownership or even citizenship people respond to in different ways. Those are other identities that I am naming. People are not responding to that. What he saw was a bald-headed, thin Black woman sitting on the bed in a standard hospital gown, right? But if he may have seen something else like legacy, like a different last name, Kennedy, Obama, I don't know. Maybe the response may have not been so insulting entering my hospital room. Do you know why you're here? Right? Because what I got was the bias that you must not know. You must be stupid, lazy, unworthy. And to be able to interface with healthcare practitioners, with social workers there, with nurses who have an ability to have self-awareness and recognize their own emotions and thoughts and values and strengths and weakness, and to have a growth mindset. Oh, that would have been so inviting. You already don't feel so well. You do not feel so well. And so to know that someone can check in, to have a greeting, compassionate accountability, a warm-hearted tenderness. I'm so happy to be able to come into the room and talk to you. My name is introduction, kindness, even when we want to get to why we're here in the hospital. I brought myself to the hospital. I clearly know why I am here. And to assume that patients know that. And to also to have a curiosity, as I shared, that where are some gaps that I may fill in some information, that I may share some information about what's going on. Let's find out what's going on. Let's unpack this together to feel that somebody is in partnership, that somebody's in partnership with the care team. So that's a lot of my story. And I thought about what culture it takes to be able to help the multiple players of the team to hear the impact of what it is like when those in the cancer community does not have relationship skills that they are able to invite and communicate and maintain a relationship with patients or their family or their caregivers with the level of compassion and respect, to know that there's that the person is holding that they have a culture, that holds the dignity and worth of the person. Just giving you some time to be able to look. I'll speak to this. What is culture? Many people think that culture is one thing. These are just 7 highlighted points. You know, culture really is the sum total. It is the sum total of the ways of living. It is the sum total of the ways of working. It is the sum total of the ways of relating, right? I live in relationship. I live, in ways that I work and collaborate. It's all of those parts, how we value, right? How the beliefs that people hold, the values. So I will say an example, because sometimes examples are very helpful for people, that I see myself, the culture of myself, and you will be able to use this in your own life. I see myself more as a New Yorker than an American, right? The culture of New York, right? I am a Black woman living in America. So the way that I identify with the country that I was born, and the way in which I have been educated and loved and groomed and protected, in my family and throughout my education with friends and colleagues, and also in my city. I feel that more in a different way than when I am experiencing that from a lens of an American lens, right? But certainly when I leave the country, I do see myself and am reminded that I am an American, right? So, but I also have the culture of where I grew up in New York, right? And so all of the patterns of my thinking come from family and school, and behavioral norms come from there are multiple seeds and deposits that are a part of all of our cultures. And the styles of communication also are a part of one's culture. And healthcare has that as well. Healthcare has a belief system. And when practitioners, patients, caregivers are being called to develop ways that are a part of their cultural conditioning. They have ways in which they are educated and socialized, so that they have ways of thinking that they relate. And one of the things that are happening is that people are making positive choices around understanding and considering the consequences and the benefits and the invitations that invite a growth mindset, a culture of compassionate accountability, that I can be seen in the fullness of myself. So to have a culture within healthcare that says that this woman sitting on this bed comes in as a mother, comes in as a daughter, comes in with her profession, but I come in as a new member to the cancer team. I come in with an interest. I am inquisitive about what is happening, and I require multiple deposits of authentic, nonviolent communication that would never infer pity or deficit, that I would be coming into this space with any deficit, to see that people may have supports already in place. And if they don't, what supports can you put in place? It would have been so helpful, even in my class, race, education, religion, citizenship, family, gender, all of the identities that I hold. It would have been so helpful to receive patient navigation that was, how about this? And how about that? Did we offer this, just to say it, just to be able to offer that, to be able to invite, that there's a culture that invites a supportive, it is a supportive and restorative practice that we guide, support patients with a sense of love, with the sense of love and kindness. The next slide really helps us to understand why some of that may or may not happen. This photograph, this picture, this illustration happened, this was many, many years ago. And many people have seen this in college settings, in work settings, professional development, workshops or seminars. And if you haven't seen it, that is okay. There was an invitation many years ago, probably 20 years by now, for people there was an invitation for people to have different variations of this. So you have other drawings, they're all over the internet, right? And so just to be able to help this before we talk about it, when it says that, defining equity is about having the quality equality, of being fair and impartial supports, and that you remember what people need. I need that, the things that I described beforehand. It's needed. It's not wanted, it's needed, right? And it's not one size fits all. So when someone is curious and coming into the room about, like, I'm here to serve, I'm here to be able to help, let's find out what's going on. Wow, that makes me feel that there's like some other attributes and qualities that could help eliminate the barrier, right? Because it created a barrier when you say, like, oh, do you know why you're here? Right? When I know that you would not say that to your mother or anyone else who may look different than me, who does look different than me, right? And so to understand equity, we must also acknowledge that inequities do exist in the world. We're not in a space in time, we're not in a space in institutions or policy or in healthcare where we're going to pretend, right? And inequities are disparities that exist due to the lack of fairness and the ideology of oppression. The ideology of oppression. And if it may help those of you to be reminded or to be enriched, that oppression really is unjust, cruel treatment or control. Not my definition, like that's what it means. And so we're all born into this. We all inherited that. And it is infused in the ways in which practitioners, caretakers within the hospital cancer community are also born into that. And so if it's not interrupted, it comes out in your speech, in your mannerisms, in your writing, in your care, in the way you create barriers or you open up access and resources, for research, biotech, for clinical trials, right? For insurance opportunities, for pathways that somebody may not know that they could navigate or that they're eligible for, right? So equity is not one size fits all, but it's about being in and cultivating connecting opportunities, right? That's how we interrupt this, so that we could create fairness, so that we could create access. So with this picture, it says to have access to watching the game. Each one can see the game, right? Because of it's not one size fits all. Everybody doesn't get the same box or crate. People get what they need, even if they need help in doing so. Some are being lifted up, one or two boxes. And so a lot of people talk about the fence, and the fence could be, often is unjust, cruel barriers because of a host of reasons. I named some that are technical, like insurance, like not knowing, but and how do we adapt so that equity is happening? What do people need? Equality is not helpful often because it's not one, everybody gets the same. But a lot of people look at this picture and they think that, okay, they're seeing the game, and they miss the point. And the point is that these three people need a ticket and a seat. They are not in the stadium. It really does look like there is a liberation and justice that is happening regarding these three people watching this game. There is not a sense of belonging. Belonging is sitting in the seat. And the one in the purple shirt would probably still need a booster seat or some sort of chair lift or accommodation. Like when I wear my glasses, I always need them to read. I always need them. So if he needs something to be able to see the game and to be able to support his ability to be able to see the game, that means he needs it in the seat when he gets there. And that is okay. It is okay to need what you need. And so that is often unspoken when people look at this picture and they're like, oh, this is equity. Oh, this is great. No, it's not. They need a ticket and a seat. Hope this is helpful. Let's look at diversity. Okay, love this. Giving you a moment to take this in. The puzzle pieces are so helpful for so many. You can see the intersectionality, you can see how they're connected. And many of these puzzle pieces, if we needed to be able to shift them around and create more grooves for them to be able to interlock, because they do, sitting on the bed, the diversity of all of the identities, the diversity of my culture, not only where I'm from, but the language that I speak, and my experiences from my family, from my teachers, professors, from my colleagues, those that I have served, those that have served me, my age, gender, job level. I am in that space with all of that, right? So culture is in the middle there, but you see it's the sum total, my skill set. So the dictionary says that it means a variety or the presence of difference. But using the term in the context of individuals, diversity means that each of us brings these unique perspectives into the conversation. Your perspectives, your social backgrounds, your experiences and identities that you have learned about. This is why we bring these perspectives into a brave conversation. People say that, oh, this is a safe space. We need brave spaces. People deserve brave spaces, right? And so acknowledging, so a culture can mean that I feel compassionately accountable, that it is my practice. It is a part of my culture as a practitioner. It is a part of my culture to be able to serve those in the cancer community. My role as a VP at Share, I am the VP of Culture at Share, the organization. It is our practice to value and acknowledge the range of social and ethnic backgrounds and experiences, and from patients, from research, from opportunities through grants and capital campaigns and donors and healthcare and support groups, that the perspectives of our team, what do we need to do internally so that we can bring this externally for those who have living experiences with cancer, right? And so they all contribute to how we manage relationships. They all contribute to how we use our environment, meetings, webinars, planning, conferences, sessions. We're using the diversity of all of us. And it's not just race or religion. It is the perspectives, the backgrounds, the experience, the talent, the expertise of those that I work with, the expertise of the women who have a relationship with cancer, whatever the relationship is, as a caregiver, as a patient, the men, the families. What are their relationships? How do we use their perspectives and their experiences to add value, to brave conversations, to be able to interrupt and end disparities within healthcare? So to be able to know that you too can amplify your voice, that you too can amplify your voice around what diversity looks like, sounds like. All of the people in these spaces are bringing in a curiosity just to be here. It was so wonderful. It's so wonderful. A curiosity that I can learn to have a practice that values and that acknowledges the diversity of all of us. That cultivates a sense of belonging. We can be included in a way, we can be included in a way that flourishes belonging. And who doesn't need that in healthcare? a collective body of people with various talents and expertise and voices and power and social capital and access and resources. The diversity of social capital, the diversity of power, the diversity of funding streams, the opportunity to integrate. That is how we are able to speak to diversity, and to know that I can have people in spaces that are doing this in their own way, powerfully interrupting all of the barriers around and within our cancer community. Next slide. So just to open up this opportunity, because I want to be able to make sure we've said there was a lot that was shared here. Culture, the sum total of the ways of living, what is invited around focusing on the holistic self, the holistic care of the mental, physical, spiritual, emotional, and social self that a person living with cancer comes into the space with. How do you treat a person in a way that you can accomplish resources that can support one or multiple parts of that person, socially, emotionally, mentally, physically, financially. Financially, we talk, there's so much new initiatives that are working and that need to be added around financial toxicity, the gate and the gatekeepers around access that people need around financial support. And there are different levels within the class, within socioeconomic levels. So I want to be able to, I say your story, and so many people have questions, and I invite that as many as we could do, depending on what the questions are. It doesn't mean that we won't be able to address all of them. Certainly, there are a lot of people on this call, which is wonderful. But how can you infuse your questions or a question, that could help us to break down empathy, diversity, compassionate accountability, to interrupt the unjust, cruel controls or barriers that are the fence that don't give people access or the ticket or a seat to what they need and deserve, living with cancer.
So
Okay, I think
thank you for that. I'm going to start with a tough one. So as we look at our programs, right, we have lots of folks on this call. They have limited resources. And at some point, a decision has to be made. Who gets patient navigation, or who will benefit the most, which we know is just full of all of the things that we just talked about that we want to disrupt. But for people who are really trying to embrace and diversify resources, what advice would you have for navigators as they try to determine who would benefit the most, or who is able to get the services of a limited resource? So I'll hit you hard in the beginning.
Yeah, that was a heavy hitter. And so in thinking about how we are groundbreaking in creating a culture of care in navigation and a culture of fairness. Look at the resources. So if it's financial, I don't know what line items, how much is it, is it in expanding criteria, eligibility? Is it in having brave conversations around the difficulty in making selective choices? I don't know if it's random. I don't know if it's lottery. I don't, there are multiple elements that prohibit. How do we turn the conversation where we have elements that provide access that don't prohibit, right? And so if it is an area for there are targeted people, right? And so I'm thinking about, ability, in physical ability, maybe indigenous, LGBTQIA plus, rural access to rural, like there are so many areas where people are in need. Those who are young, who are experiencing cancer, the elder, child care, elder care. There are so many areas that you can help. Acupuncture, massage. There are so many. Like, what is it that you want to be able to navigate? So I think that looking at the holistic wheel of mental, physical, spiritual, emotional, social. Are we looking for support groups, recreation, exercise, diet, nutrition in the social area? Like there are, you know what I'm saying? That this answer could go on and on and on. But what I'm saying about is how do we enter in the space with whole new ways of thinking and speaking in a way that says we have limitations, but what are we going to do to add to what we didn't do last year? When you said no, how can we say yes? In money, in voice, in publication, in speaking. I know that when I look at the recording of this, I'm going to say, I should have said this, that.
Well, I probably should have teed you up for that one, but as you were
That's
thinking,
okay.
I thought about, the navigation programs that I'm familiar with, right? And we may say, oh, we have a navigation program if you speak Spanish, or we have a navigation program if you are not insured, or we have a navigation program if you meet this criteria. And as I think about our own biases, right, and the diversity is more than one checkbox. I guess I'm just saying aloud, right, what I am now wondering about, but I know that we have tremendous opportunities for growth, and that we just need to keep working to create these spaces. We do have a couple of other questions in the question box.
Yeah, I think that before you go to the next one, I think that when you just said language, that is a part of diversity. So, I have had families who would say, we speak French and Arabic, or we speak, like one family said, we speak French and English, but I read in Arabic. Like, how do you have a navigation? How do you have space to be able to say, oh, you could be in a support group for this. Your family could be in for this. I know that the literature that you need. I know that there's so many ways in which you can, and we have families who are coming, who are here, who speak multiple languages, but may read or write in one another thing. I'm just trying to provide, a different perspective as to how you can help a family navigate just based on their own experiences and knowledge. Thank you, Heather.
You're welcome. And I did write down, ignorance is not a curse word, right? So
That's
to
right.
be curious and to be authentic and to say in plain language, right, what you want to know. And that's how you build these relationships that are so positive and meaningful. We did have somebody who asked early on when you were talking about compassionate accountability as a navigator, how do you demonstrate compassionate accountability? And I know that that's not a one-word answer either, but I wanted to make sure we address that question.
Oh my goodness. That's a whole nother webinar. very simply, it is action. It is people, just like equity and equality, people use the words interchangeably and they do not mean the same thing. And compassion and empathy, and particularly compassionate accountability, does not mean the same thing as empathy. And so it really is a warm-hearted tenderness that propels you. You often also feel compelled to take action to alleviate suffering. It's not that you're just kind and nice to them. I'm taking action so that this doesn't continue, or that it doesn't is exacerbated or forgotten. But I am compelled that there is a complexity in how do I sort through what actions need to be offered through guidance, through support, through trial and error, through education, through, I was gonna say boots on the ground. I don't have another. We have to do something. Sometimes people have to get up and go. It's not just a survey or a poll. It's that we actually need to create and help inform language around a policy to be able to connect with pharma, or to connect with a nonprofit, so that we can engage in a dialogue. And we know that this wording and that this information gives a social reality to what this policy may need.
Thank you.
You're welcome.
We have a comment from somebody who basically said that in rural areas, and that sometimes nurses forget to empower and educate patients, but instead we're trained in the do as I say model. And she was just saying how helpful this is to hear a reminder, right? That the do as I say isn't authentic, right? You need to learn about the person, about their experiences, what they bring to healthcare. I think I remember you sharing a story about your own cancer diagnosis and thinking that you were the first one in the family with a cancer diagnosis, and learning that you didn't. Has that experience added to your story at all, or do you have any words of wisdom for people?
Yes, I will first say that the person who shared that, their appreciation of being reminded that our part in the shared reality of diversity is in the uniqueness and difference of individuals and groups, but it is also in learning to respect the differences that add value to our collective humanity. This adds value to our collective humanity. And in my family, when I did think I was the first and I was the fourth, and the diversity of their experiences and interrupting the long suffering of women not saying anything and moving past the big C and calling a family brunch, and we all of the nieces, nephews, cousins, and everyone came with their children, and interrupting that. And so there are 4 generations. I'm on this generational line. It is now highly probable that someone may have a diagnosis of cancer at some point in their life, and how helpful that would have been to me. And also knowing that I had a warm-hearted tenderness to not have any shame or blame for women and family members who inherited that you keep things to yourself and you don't talk about it. There's no shame or blame around that. We're interrupting that. And now they have joined forces in their 80s and they are talking about it, but didn't speak in their 60s or 70s. You understand? And so that's a part of respecting the differences that we have inherited and that people are also unlearning, including members of my family and members of your family and all of the families that are here. So that our collective humanity is saying that we're interrupting, we're giving people what they need. And for some elders, they need time and space and brave conversations to be able to know that it doesn't have to be like this for our family anymore.
Yeah, I think it's so important to really think about learning about the culture of cancer in someone's bigger family, and to learn about how they'd like to experience it themselves, right? Because no one comes and says, oh, I want to do it this way, or I'm going to do it just like everyone else. You have to really take the time to learn. We have
But you don't know
another.
that. But people don't know that. I didn't know. That's why you need a navigator. Like I didn't know. I learned along the way and it was very difficult. But I don't know how. I didn't know how I wanted to experience it. But when something came to me, I know I didn't want to experience a condescending pity tone from my nurse. Right.
Yes. Somebody wanted to know if you think it's important, or maybe this is just a bigger question, maybe it's not about what you think, but generally, right, is it important to have navigators who have the same ethnicity as the patient, or why is it important that we have diversity in healthcare providers?
So it can be very beneficial and helpful to have navigators who are similar or the same, or has done their own work in their own racial or cultural identity development, right? So when people are similar, right, to have another woman or to have another woman of color would have been, or a person of color would have been very helpful to me, because sometimes when there are things that are happening, I don't have to explain, right? When cheerleaders are talking to cheerleaders, they have language that they share that I may not understand. I don't know what the language around their flips and jumps are, right? And so to be able to take the time to be able to explain that, there's a difference. However, when somebody understands, there are things that can be learned, right? And it doesn't mean that you have to learn it all. To have a navigator is important. It is essential. When you can get someone who is as close as possible, right? There are certain customs, traditions, beliefs, dress, um, uh, practices. When I worked with a family, and the father was a chief of his Native American nation, was one of the chiefs. And we had to learn, what do I need to do to learn how to speak about, it was particularly about his children. We had to be able to say it in a way that was respectful and uplifted the traditions of language within his family. How do I adapt for them? Not them to adapt for me. So we had a family chat so that I can learn. And it was wonderful, right? And so that's the culture. How do I enter into the culture of that particular family?
And I think kind of right on track with that, somebody wants to know, how do you start a conversation? And I think some of what I'm hearing is just asking the question, what would you like me to know about you to, right, provide or be a good care partner? Or what do I need to learn about your experiences? I guess, this person is saying that people have trouble starting conversations or asking questions, and that they want to, sort of know what are some phrases. So I think, that there are people who before this talk would have saying, oh, do you know why you're here, is a good icebreaker, right? Well, it is for some people, but it certainly wasn't for you.
I don't know. I don't
right?
know if that would be a good icebreaker for anyone. Like, I don't see how it would break any ice. I don't feel well.
Right,
You know
right,
that I'm a cancer patient. So I don't.
right,
I understand what
yes.
you're saying, Heather. Right. So I think that one of the things is for people to do their own work. It's not the onus to go in and ask a patient all of the questions. What can I teach you to work with me? Do your own work, and to be able to come in with a sense of humility to say that they understand that, you know, um, it would be helpful to know that, to hear somebody say that I am somebody who engenders a stance of curiosity and humility, that I am looking forward to having open discussions and connections with you, to be able to pay attention, to be able to relate, to be able to interrupt dynamics, to be able to help ways to help you navigate ways to self-disclose your story, your feelings, the impact of what is going on, that I am here to help you navigate that. Not what do I will be listening. I will be actively listening, clarifying, validating, acknowledging ways so that I can help guide and support you to engage in this experience. That would be helpful to hear, and not all of that, but some of it, some of that along the way. Like, I'm literally editing and thinking about the care and warm-hearted tenderness would be so helpful to receive, not somebody to come ask me, what is it that I need to know about you? We can read the chart and we can start to talk. You share some things, I share some things. How do I make myself exposed, in helping you? Oh, that I can relate to that. That happened to me. It would be nice to hear a navigator or a health practitioner. I can remember a time, or I was socialized to believe this. Now I know this. You know, just last week, I can remember when this happened to me. I now know this. I see that this is those kind of ways that reveal our collective humanity, the dignity and worth of both of us in this journey.
Yes, take time and be your authentic self.
So,
So the question and answer box is full of praise, appreciation for your storytelling, for your passion. There's lots of other questions that it doesn't look like we're going to have time to get to, but I will share them with you, and maybe we can revisit them. I really am so thankful and grateful for this opportunity. I think, I learned a lot. I have lots to think about. And I so appreciate how you're able to, help me to think more about what I do, right? To have authentic curiosity, to think about my own experiences, what I bring, and to anyway, I'm just very grateful for this conversation, and we have lots of positive kudos in the chat as well.
thank you so much, Heather. You have been spectacular. I mean, your determination to bring exposure to the American Cancer Society, your work, your lens, you are very authentic in your quest and development, and what you have done as a social worker to be able to create access already. I'm very, very happy to partner with you and your team. Thank you so very much. Thank you.
Thank you. We invite everyone to join us for our next two sessions. We have two other great programs coming up. The next one, we'll talk a little bit about programs that were designed at Dana-Farber Cancer Institute in Boston to help build a program for the community that they serve there. And then on our last session, we will be having some boots on the ground, right? We're going to have some voices talking about their experiences, patient navigators sharing some of their wisdom or lessons learned or authentic curiosity in providing care. And to wrap it up, I just want to once again thank our sponsors. We're so happy that we're able to bring you these terrific programs. We will be sharing the recording and the slides out. And once again, Ife, thank you so much. And thank you everyone for joining us. Have a wonderful, wonderful afternoon.